Hey, everybody, this is Chad Campbell, certified functional medicine provider with Redesign You and Hope Family Care. And I wanted to come to give an update. We have had our first 2 positives in our community, and so things just got a whole lot more real for us. For those who aren't in our community and maybe out of our city or out of state, I don't know if this has been your experience, but it has been for us. It's kind of like you're doing this preparation, watching this movie happening somewhere else, praying for these people, watching this, and then hearing all of this horrible stuff that's happening that the news and the media keep saying that are being manipulated. That the media keeps manipulating a lot of this type of stuff, so you don't know what in the world is real, what's not real. And that's what I want to talk about today. And all I want to keep us doing is talking about the facts, not about the fear, but about the facts. And that we can make our decision based off of those facts. So again, this is my role for you, is to bring to you the facts of what's happening so that you can make the right decisions. Okay, let's get into this. So today I want to go over some stuff with a little bit about the virus. I want to talk about what happens when somebody tests positive. And I want to answer the 2 biggest questions that I keep getting asked over the last week and a half or so. One, I want to go over a little bit about what the virus is. These viruses, people are like, what's the big deal? This is a virus. It's no big deal. The big deal is some of these viruses, even influenza, 65% death rate. You look at SARS and you look at MERS. Those are what are called zoonotic viruses, where it's transmitted from an animal to a human, but cannot go from a human to a human. Okay, so it's from an animal to human, but can't go from human to human. SARS was from a type of a cat to a human, and MERS was from a camel to a human. COVID-19 is from novel COVID is from human to human. All right, so that's the transmission that's happening, human to human. And this COVID-19 is not nearly as worse or as bad as SARS and MERS. The death rate, again, we talked about 1%. Now they're saying it could be as low as 0.3% all the way to 1%, because we don't know the true statistics. We don't know the true numbers on this. Take, for example, New York. New York now is putting in their COVID death statistic. Anybody that has died that could possibly have had it, whether they were tested or not. So even if they were never tested for COVID or seen as a COVID patient, they're being added into the statistic of the death rate of COVID. And this is that whole manipulation and the fear tactics that are continuing to happen. So we're going to stick with facts, okay, with facts. So some people may say, well, if it's 0.3 to 1% death rate, then what's the big deal? The big deal is who you transmit it to. So from my staff, we're always keeping in our mind is, what would I do if my grandmother was sitting right next to me? Because that's the one, my 87-year-old grandmother right now sitting next to me. What would I want to do to protect her? What do I want to do to protect my close family member with horrible heart disease? What do I need to do that? Because I don't want them to be a statistic in that 0.3 to that 1%. So this is a common sense thing. This is common sense. And we have to take all of our precautions to protect them, okay? To protect them. Protect them. I have been very transparent from the very beginning, and I'm going to tell you again, I did not believe this virus when it was coming out. I'm like, what's the big deal? This is just another big media hype, another political thing. When H1N1 came out, I was in Mexico City and they wouldn't let us leave. And they were blowing this thing up on how horrible it was going to be. And it turned out to be a total bust with a 0.1% death rate. So when this came out about this coronavirus in the beginning, I was like, this is just another virus, just another flu, no big deal, blah, blah, blah. And then I took my family, my wife and my 2 kids on a cruise. I did, because we had been booked and we wanted to go on our vacation, and I didn't believe it anyways. And that was over 5 weeks ago. We went, they closed the port after we left. We came back, we got off, and we took all of our precautions because then we found out more information about this. So I only say that to say I was desensitized to it from my past experiences. And I know that many people are desensitized to this because they don't believe the media, which I don't either. They have heard this before and it didn't come of that. So right now is not the time for us to make a decision if this is as bad as everybody says or not. Because right now is the time that we need to protect our loved ones and protect our community to make the right decisions so that we can move past this, okay? Because what are we gonna do, right? The peak in Arizona, catch it. Please do me a favor. I have never asked this, but I'm asking you to please share this with all of your friends. Share this with your friends so that we can do this as a community together, okay? This is not a business thing. This is not a financial thing. This is, we need to pull together to do this. Because as much as I would love to say, the medical offices, the hospitals are all working together for this, they're not, okay? They're not. And I might get some hype on this, but they're not. So we as a community have to do this together, okay? So please do that, please share that, because the peak in Arizona is June 11th. It is only April 15th right now, April 15th. And our peak in Arizona, the guess on this, our peak in Arizona is June 11th, which is almost 2 months away. Social isolation is to continue for 6 to 8 weeks after the peak. So if you realize that, that means we're going into mid-August, you guys, on social distancing. The isolation part, how far does that go? Nobody knows because they don't have the numbers yet. They haven't seen anybody go back from isolation to find out if there's reoccurrence or not. So right now, if our peak prediction is June 11th, we're looking at this going until mid-August. And so what do we do about that? We have to prepare. We can't complain. There's nothing you can do about it. We can't make things up or predict what's going to happen because nobody knows what the virus is going to do yet. The good thing about where we are, and I'm sorry for those of you who live out of state, but the good thing for us is we're getting to live off of the experiences that's happening in these other areas like California, New York, Louisiana, Georgia, to help ourselves. For those of you who were there, stay with your common sense, okay? Don't get overzealous about getting out and start to do stuff. Nobody knows about this virus. And South Korea has reported 91 reoccurrent cases. Now, right now, we don't know what's real, what's not, right? And so I promise to bring the facts. I will continue to bring the facts, and I'll keep researching this, waiting to see if these are real numbers from South Korea on the 91 reoccurrences. They don't know if it's a reoccurrence of the previous infection or if it's a reinfection a second time, or is it all just bogus, right? We don't know. So I will bring that to you as soon as we find out. All right, so who's to get tested? We wish we could test everybody, but we don't have the testing for it. We don't have the testing to be able to do this despite what people may hear. So right now, respiratory symptoms, fever, exposure to COVID, or high risk, okay? Nursing homes, living with other people, those type of things. So those are the ones, but it's very clinical. It's based off of the provider and what their discussion is with that person. So I wish we could test everybody, but we can't. So for now, it's still based off of respiratory symptoms, fevers, exposures, high risk. If you have had exposure to somebody, people are wondering, when do I get tested? If you have no symptoms, you were exposed to somebody to COVID, isolate yourself, okay? Unless you're a healthcare provider, healthcare worker, or first responder, you're gonna isolate yourself and those who are around them. And then we can test you anywhere from 3 to 5 days after that exposure. If you get exposed last night and you want to get tested today, it's a waste of a test. We're not gonna do it because it's not gonna show positive. Jenny from our local health department has been an amazing resource for us. She's working close with us on all of this. and trying to bring this to where we can collaborate together to help our community. And please pray for these health department workers, man. They are working 7 days a week. Some of them working from the very beginning of when this all started, and they go 7 days a week till it ends. No rest, no breaks. They're working their butts off. So keep them in prayer. So if somebody gets a positive, so let's say we get a positive, what happens next? If we get a positive, we then report that to the health department. Okay. We will go through all of our isolation, depending if the person needs to be hospitalized, if their O2 sats have dropped, they're having pulmonary lung issues, then and their comorbidities, meaning other problems, then we will make a decision if they need to be admitted or not. If they don't need to be admitted, then we're going to isolate them and treat them the way that needs to be treated as far as symptoms control. We then notify the health department. The health department then will contact them right away. Once they do, they start what's called a person under investigation, and interview that person. And then they find out, when did the symptoms start? Where have they been, and for extended periods of time? Because remember, just because somebody walks into Walmart and you were in Walmart that day doesn't mean that you're going to get this. This is a load of exposure. Okay, so if you were in the back sporting goods section of Walmart and somebody came in and they were buying fruit, you're not going to get COVID and that kind of separation. So where have that person been for extended periods of time, and what people have they been in contact with? And then those people will then be contacted. Okay, so the health department will then contact you if you were exposed to that person, and that's how the whole process starts. So then they start this whole pyramid of trying to figure out where it goes to keep these people in isolation. That's why if there's any ways that we're able to work with rapid testing to be able to isolate these people quickly, it's going to help our community a lot more. Currently, our tests take 3 to 4 days to get them back when we test somebody for this. So that's why when somebody has the symptoms or we test them, while we're waiting for the results, got to go home, man. You and everybody else needs to stay in isolation until we get these results back. Then we can go from there. So that's the process. We notify health department. They then, person under investigation, they interview that person, find out who they've been around, find out what places they spent extended amount of times in, when their symptoms start, to try to figure out when the virus might have happened. And then they just start the plotting. And they just go on that plotting process. So gloves, people keep bringing up the glove thing, and yes, we need to remember gloves. This is all a reminder. We've talked about this in the past webinars. Death rate of 1%, maybe as low as 0.3%, like we talked about. People at higher risk, comorbid conditions, diabetes, overweight, lung problems, heart problems, vaping, smokers, nursing homes, those are all much higher risks. But gloves, let's talk about gloves, because there's a cool video out done by an RN on a social media site, and she was showing how she had this substance. I wish I could find some kind of substance that we could put on people's hands and then let them go through their day, and then put them under a specific light at the end of the day to see where they touch themselves throughout the day. But this RN does a good job of showing this, that you think that you're not touching things, but you are. You know, so even if you have gloves on, people are wearing gloves and then touching their cell phones with their gloves on. Well, you just took it from wherever you were and put it on your cell phone, or your keys, or your wallet, or your pen, or your computers. And so if you're wearing gloves, wear the gloves, but don't touch anything personal. Leave your cell phone in your car. If you're going into the store, put the gloves on, you can grab your stuff, but then take them off before you get into your purse. You know, so don't touch your personal items with your gloves, and don't touch your face, because you're just going to spread it. Masks, remember the surgical masks and the homemade masks prevent you from giving it to anybody else. That's why the recommendation is now for everybody to start wearing those masks. So because many people are asymptomatic, so they're trying to prevent you from giving it to somebody else. If you don't want to get it from somebody else, N95s or respirators, okay? That's about all that you got. But don't touch your mask. Don't touch it, all right? Because then it's on your hands, on your gloves, then you're gonna touch your personal items, blah, 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 right? The point is, guys, is that you're going to mess up. You're going to mess up. Do your best. Still, the best thing for all of this is soap and water, washing your hands, washing your stuff. Okay? Many people have asked, what do I do with food? You go to the grocery store, you buy your vegetables, your fruit, your boxed goods. My wife, she's amazing. She is a certified functional medicine health coach. And so she's going to try to put together some videos on this for everybody so that they can see some tips that washing the vegetables and the fruits, what to do with some of the goods. And she'll be putting that out soon for everybody. So just watch for that to try to help people out with that. So I just, you know, one of the good things for us, and this is horrible for those others, but one of the good things for our community, and this is to encourage our people in our community, is that we get to learn off of everybody else. How often do you hear about the hydroxychloroquine anymore? You know, you're not hearing about it much because they've actually shown now in some of these studies that when you give that in that second week, it's actually increasing the risks and the complications. So you're not hearing about that much anymore. Medications with that hydroxychloroquine. The other one now that you're hearing a lot about is ivermectin, which is an anti-parasite medicine. That's one that's being studied that they're looking at as well, and you're still hearing about taking the blood antibodies out of other people's blood and using that to help with treatments. Still, nobody knows. And steroids now are being used in certain people with certain conditions, and they're showing that it actually helps prevent them from having to go to the ICU on ventilators. But it's a select group of people, and these are hard decisions to make, whether to do steroids or not. So the two biggest questions that I keep getting asked over the last week and a half is, first one, what supplements do I take? Because of the controversy that we've talked about in the past webinars. And as you have seen, with this changing information over and over and over again, is that something from 2 weeks ago most likely is not very pertinent now. So I wouldn't even recommend going back and looking at stuff unless you're just wanting to know about the virus itself. So what supplements do I take? That's the first one. And the second one is, what do I think about this doctor who keeps telling everybody to take quinine, this video? Okay, so the doctor who's telling everybody to take quinine is a chiropractor. I have nothing against chiropractors, just telling you, it's a chiropractor. There's absolutely nothing to show that quinine and high doses of zinc are going to help with COVID-19. Nothing right now. So it's his assumption, it's his own theory, and if you want to go off of that, that's your decision. I don't, and I'm not, and I would not do that with my family. It's not something that is an option to me until somebody shows the safety of it as well as the efficacy on how much it actually works. So no, I'm not a fan of that. I do agree that the media is changing and manipulating information without a doubt, but I don't agree with quinine or high doses of zinc like that. So my supplements that I take, I do take a GI shake, which is an overall immune and gut health, because the gut is the foundation of your home. And if the gut is not absorbing nutrients and doing well, then the immune system is not going to do well either. I do take vitamin D if I'm not out in the sun that day for more than 45 minutes to an hour. I do take my magnesium, and I do take an adaptogen because of all the hours that we're working and the high amounts of stress load that's happening right now to help me through the days as well as sleeping at night. So if anybody wants to ask anything about those, just send me a message and I'd be happy to help you with that. You know, here at Hope, we're prepared. We have our protocols. We are prepared to help our community to get through this. We're not afraid of this, okay? This is a stepwise process of the facts to help people to get through this and hopefully prevent this from taking off in our community if we can get people to pull together for this. So don't hesitate to call us. Don't hesitate to call for our opinion or to send us messages. Even if you're not our patient, we are still here for you. We will still see you. We'll still evaluate you. We'll talk to you on a phone. We'll do a televisit with you. If you don't want to go somewhere, don't hesitate. We are here for you to help with this. And I'm begging you to share this with your friends and people, because the only way this is going to work is if we can do this as a community. All of the social media stuff that's been happening with people on different sides of what to do with this. Now is the time to stop doing that. Now is the time for us to come together, to work this thing together. And we have to have a central place to do that. And I'm asking you, let me give you the facts. Let us do this together. Let us help our community through this. Call us. We will help you. Okay. We will see you. We will not turn you away. All right. We won't do that. So remember, no fear, but to understand that the facts, we understand the facts. Facts. I want to end with this, and this is not to put fear into people. This is what many of the known virologists, which are people specializing in viruses, and epidemiologists are saying that study these things from around the world. This COVID-19 is a trial run for us. This is not the Big Bang. This is a trial run. That there is coming this larger viral infection that is going to come, that is going to be much worse than this. That's their prediction, not me. That is their prediction. And again, we're supposed to be doing facts over fear, right? The only reason why I wanted to bring this is because use this as a trial run. Look at where you are not prepared if something were to happen with you and your family. Look at how much you rely month to month. Look at your community. And do you have a supportive community around each other? Okay. Use this as a trial run to prepare yourself for if what they predict is going to happen here, that you'll be ready for that. And again, please do not hesitate to contact us, share it with your friends, have them contact us, send me messages through Facebook of Redesign You Facebook or Whole Family Care Facebook. Message us, whatever it takes. If you have questions, you're sick, you need to be seen, you want something answered, you have a fear, contact us. We're here for you to help you through this hard time. Until next time, thanks.